Hello and welcome back to another Refrigerator YouTube video. I'm your host, Johnny Barba, and today we're going to be talking about birth trauma, specifically those that happen to the head of the infant. I'm talking about Caput secundum, Subgaleal hemorrhage, and a Cephalohematoma. When going through board questions, I kept repeatedly missing these questions because I did not have a systematic way to go through them in my head, nor was I understanding the anatomy sufficiently. And so this video is both high yield for the wards and high yield for the board. So let's get those test points that we deserve on test day. So to get started, I like to think, what do I know and what can I derive from what I already know? Well, think about this whole infant's head here, okay? But we're just going to draw certain layers of the head, all right? So I think, what do I remember? And I gotta just touch my own head. Oh, okay, I feel a bone there, right? So I know that one layer of the skull and the scalp is the bone. Okay, what lies on top of bone? What really adheres tightly to the bone? Oh, okay, that's the periosteum. Yeah, that makes sense. I remember that. I can derive those two facts. And then if you go ahead and you feel your own scalp, I encourage you to do it, kind of feel it. I mean, that's kind of like, it's not just like skin. Like, this is different than this. Like, you can feel like this has a little bit more substance to it. And that's because there's an aponeurosis there called a Galean aponeurosis. All right. And then on top of that, we also just have kind of like our normal scalp. Okay. All right. So that's the cutis. Okay. So those are the four important layers that we must understand to understand these birth traumas. And so now we're just going to pick one layer up one by one. So if we pick up the cutis, what collects underneath it? If we pick up the Galean aponeurosis, what collects under this? If we pick up the periosteum, what collects under that? And so that's our systematic way of remembering these and being able to derive these in our mind quickly so we can answer these questions. So let's start with the first one. Let's pull up the cutis. So I always remember that I can draw the bone. All right, there's my skull. Then I remember, what adheres tightly to the skull. That's the periosteum. Then my head, it's a little bit more substance there. That reminds me of the Galean aponeurosis. And then on top of that, we have the cutis. But remember, we're going to have something collect underneath the cutis this time. Okay, so when fluid or other collections of fluid underneath the cutis occur, that is called a caput secundum. And I am going to cheat and look how to spell secundum, because I cannot do it to save my life. Okay, there's caput secundum. And so this fluid collection kind of collects underneath the scalp here. And the way I remember this one is by thinking of caput, so cap, and then this S here stands for swelling. This is just good old cap swelling. So I want you to think of a cute little baby infant and you put a little hat on him. That hat's going to cross suture lines, right? And so that hat is all over the scalp. And so that is a caput secundum. It crosses suture lines because think, is there any suture lines or anything like that in the cutis? Oh, look how far up we are in the layers of the scalp and the skull. No, there's no suture lines up there. So the fluid can travel beyond suture lines easily. So travels beyond sutures. Okay, but I think that's all intuitive if you understand the anatomy. And so caput secundum, I think of cap swelling. No treatment is needed. It will simply resolve on its own. All right, let's pull up the next layer of the skull. So just go ahead and feel your skull. Okay, what are we going to pull up next? We're going to pull up the Galean aponeurosis. So again, we start with our paradigm. We can remember the bone. We can remember that the periosteum is tightly adhered to the bone. And now we have the Galean aponeurosis up, and on top of the Galean aponeurosis is the cutis. So we have the cutis and the Galean aponeurosis. And so in this one, notice the color of marker I'm going to use. I am going to take red and I'm going to fill it in here. This is the worrisome one. This is called a subgaleal hemorrhage. And think about it for a second. Why would this be called a subgaleal hemorrhage? Sub means below, and galeum. Okay, we just called this the Galean aponeurosis. So there is this blood collection below the Galean aponeurosis, hence the name subgaleal hemorrhage. So let me go ahead and write that out. Subgaleal hemorrhage. Okay, and this all makes sense. Okay, let's break it down. So sub means below, galeum. So it's below the Galean aponeurosis. We're all good there. And it's also a blood collection. This should be making you nervous. Subgaleal hemorrhage. Do you ever want to hear somebody say to a baby, they're having hemorrhages in their brain or in their skull? No, that doesn't sound good to me either. And so when you think of this one, you really should be afraid because this G here reminds me of grave. And that's because this one can be life-threatening. Subgaleal hemorrhage occurs due to rupture of emissary veins. Okay, rupture of emissary veins, high yield. And basically, those rupture of those blood vessels allow for hemorrhage to occur in this layer of the scalp. And so this is important because infants, they're just little tiny human beings, and they can lose a lot of blood volume here inside of this layer. And so that is how it presents. They can lose blood volume and actually go into hemorrhagic shock. And so one of the classic board presentations I've seen of this topic is how you have an infant, perhaps after birth, maybe they had a forceps assisted delivery, something of that nature, vacuum assisted delivery, and then their scalp's kind of measured at 30 centimeters at birth, measured at 30 centimeters. Then 6 hours later, their scalp is now like 50 centimeters. Whoa, how did their head circumference go from 30 to 50 centimeters? That's because there is hemorrhage. Okay, it should make you scared anyway. Like an infant's size of their head, you're going to be thinking, are they having some intracranial hemorrhage going on? Did they get their vitamin K shot? That's probably where my mind goes first. But then in the stem of the question, they will mention that there is this fluctuant fluid on top of the scalp. Ha! Now you know it's a subgaleal hemorrhage because you can feel the fluid collecting outside the scalp. They are hemorrhaging into their scalp, literally, and they might go into hemorrhagic shock. Let the G and subgaleal hemorrhage make you worried that this could send them to the grave. And so this is important to note too, that it can cross suture lines. Is there any suture lines here you can feel your scalp? I don't feel any suture lines there. And that's important to know because subgaleal hemorrhage, just like the caput secundum, can pass suture lines. Passes suture lines. And so you might be wondering, Johnny, how am I going to differentiate caput secundum versus subgaleal hemorrhage? Based on that presentation I just gave you of an infant with a certain size head at birth, and now hours later their head's getting rapidly bigger, maybe they're becoming tachycardic, they're showing signs of shock, look for that clinical vignette, and that's how you would know that they're talking about the subgaleal hemorrhage. All right, let's wrap it up now, and let's talk about our last manifestation, which is the cephalohematoma. So let's remember the paradigm. What can we always remember? Well, I know the skull has a bone. All right, we're good there. Maybe not that small of a bone, maybe a little bit bigger. All right, so here's the bone. What adheres tightly to the bone? Well, that's the periosteum, and I'm gonna draw it like that. And then on top of the periosteum, we have the galean aponeurosis, and then we have the cutis. So let me put all those in there. And then we have the periosteum. Okay, now we're gonna get a collection of blood underneath the periosteum. What do you think would be a great name for that collection? Oh, I like subperiosteal hemorrhage or subperiosteal hematoma. Oh, I love it too, but that's not the case. It is called a cephalohematoma. All right, I'm gonna write it here. I'm just gonna make the hemorrhage go back. We'll move it over here. So this is a cephalohematoma. All right, when looking at this name, I want you to notice two things. What does heme mean? It means blood. That's why I'm writing in red. There is a blood collection beneath the periosteum. Okay, what does oma mean? All right, what do I know? What can I derive? What do I already know? I know lymphoma. Lymphomas are masses, lymph nodes, big lymph nodes. There's cancer there. Lymphoma is a mass. Okay, oma means mass. So hematoma, that means a blood mass. And that's exactly what happens as you get a mass of blood on the scalp. And this is really important because if you think about it, the way to delineate cephalohematoma from a subgaleal hemorrhage or caput secundum is that the cephalohematoma is bound by suture lines, okay? So just think about the periosteum. Here's the bone, and it is tightly adhered to the bone. And right here, they'll meet a suture line on the bone, right? And the periosteum is really adhered there, and the periosteum is really adhered here at the suture line. And now we're getting this hemorrhage, or this hematoma, I should say, hematoma, or blood collection underneath the periosteum. And the way I remember this is here's the H in cephalohematoma, and I just kind of draw my H, exaggerated it, because that reminds me that the periosteum is bound by the suture lines, and so then we get the collection. So I think of the H being anchored down by the suture lines in the periosteum. So that is a cephalohematoma. Cephalohematomas, they require no treatment, and they're more of a localized swelling. So if you see a localized swelling on the scalp, remember this one's bound by suture lines. So just think about the sutures that you have on the head, and if you can delineate where that swelling is, you'd be like, oh, that's probably a cephalohematoma because it's bound by the suture lines, versus subgaleal hemorrhage and caput secundum, it's going to be more diffuse across the entire scalp. And so this one requires no treatment, and it should self-resolve. Now, they can get secondarily infected, you can't get calcifications, but that's really beyond the scope of our board exams. Really, the one they're going to test this on, I think, is subgaleal hemorrhage, because you do not want to miss that, because it could be life-threatening. This person needs to go to the ICU. These two people could use some reassurance and that it will self-resolve. So I hope you enjoyed that this refrigerator YouTube video, and I hope to see you in the next one. Johnny out.